Hey there, Dr. Nearpass. I would love for you to just kind of introduce yourself, explain who you are, what you do, where you practice, and maybe a little bit of a brief explanation about your experience in the topic that we're kind of chatting about today.
Okay. Well, thanks for talking with me this morning. So my name's Kim Nearpass. I am a registered naturopathic doctor in Frisco, Colorado. My husband and I've been in our practice for 16 years. We have the Mountain River Naturopathic Clinic here, and we serve mainly residents of the Summit County area, as well as the surrounding area, more rural areas of Park County and Lake County, Chaffee County, um, and up towards Grand and Kremling.
Awesome. Great. And so the reason that I reached out to you is because I found you online and I saw that you have a focus in women's health and you have some experience with women who have HPV and varying levels of cervical dysplasia. So before we kind of hop into the how, um, would you mind maybe just kind of explain to whoever's watching or listening here what your overarching healthcare philosophy is when it comes to treating women with these diagnoses?
Our goal really as naturopathic doctors is really to treat the underlying issue. So it's not about treating symptoms, it's about looking at how the body is supposed to work, what's optimal physiology, what's optimal function. Um, and if things aren't working the way that they should be working, we want to try to figure out why. So it's a bit of a detective work and it's taking it to a deep level. So we're looking at multi-systems. So if I have a patient who is coming to me primarily for cervical dysplasia or for high risk HPV, I'm not just going to talk about what's going on in the cervix. I'm not just going to talk about what's going on in the reproductive system, but I'm going to talk to that patient about her diet. I'm going to talk to her about her lifestyle and her stress levels, about her job, about her family dynamics, about what sort of toxic exposure she may have, what sorts of co-infections she may have, looking at the digestive system. So, really it's a broad spectrum medicine where regardless of what the primary concern is of the patient,
Hmm.
we're looking at the whole patient. And my focus as a naturopathic doctor in school and in my practice over the past 16 years has really been women's health. I really enjoy working with women's health, and there seems to be a gap, I think, in resources for women who are dealing specifically with these issues, with cervical dysplasia, abnormal paps and colposcopies, and
Hmm.
um, the human papillomavirus. So this has been an area that I find that naturopathic medicine really shines. So it's a comprehensive global perspective on the issue.
Right, love it. I definitely align with everything you just said. So I'm glad we got
Great,
another lady powerhouse out there
great.
treating the whole body. I feel like sometimes medical doctors can really scare these women into saying like you don't have time to try anything else because your moderate to severe cervical dysplasia could turn into cancer at any moment. And I feel like maybe in some cases that could be valid. But I'm just curious, when you're working with these women, how you change what you're doing.
Think again, it goes back to what I was saying earlier that it's based on each individual. So there's a lot of different things we're looking at, right? When a woman gets a PAP or she has a colposcopy and a biopsy done, there's a level of abnormality of the cells. So I look at both what's the health status of the cells themselves, and then what is the health status or what are the test results showing as far as the strains of the HPV, the human papillomavirus? So those are two different things. And so if somebody has a CIN2 and a 16, 18 HPV diagnosis, that's a more urgent situation. So I do, as a trained medical provider, I still need to work within the confines of what is the standard recommendation, right? So if a woman gets an abnormal pap, I am going to recommend that she has a colposcopy if that's what the guidelines state that she does. Um, but one of the things that happens in Western medicine is that there's a lot of wait and watch, right? So
Hmm.
wait and watch if you're below CIN1, well, we're just going to wait and watch and wait and watch. I don't ever wait and watch. As soon as there's any abnormality, even if it's just an ascus or an atypical squamous cell
Mm-hmm.
with a negative HPV, I'm still going to act on that because there's some sort of imbalance that's causing some irritation and inflammation. So I'm looking at what the PAP and what the colposcopy and what the HPV test results say, but then I'm also looking at who is this woman? What are her other risk factors? What's her history? Has she already had 2 LEEPs, or has she had abnormal PAPs for the last 10 years, or is this the first time it's ever come back abnormal? So that
Mm-hmm.
plays into my recommendations. I'm looking at what ability this woman has to make the changes. So if someone's willing to overhaul their diet, if someone's a smoker and they're willing to quit smoking, the more a woman is willing to do or able to do, I think the more aggressive we can be with naturopathic medicine. But regardless, if a woman ends up doing some of the allopathic treatments, whether that be a LEEP procedure or a cryo or a partial hysterectomy or whatever it is, there's still a lot of things that we can do to support her through that, whether it's, healing up the speeding process after the surgery, anything that we do to improve someone's nutrition and immune status is only going to benefit them moving forward. So
Right.
it's not an either or an or, and it really is based on each individual's risk factor. I want to support women as much as they can, but I also don't want to put anyone in harm's way.
Excellent answer. Yeah, that was great. Can we talk a
Good.
little bit about supplements? So I know that there are some key supplements that women either have found through research online or from their either medical doctors in some cases or their naturopathic doctors. And one of the more popular buzz ones has been this AHCC brand of like a mushroom extract that's come out. So I'm curious if that is something that you feel like is a critical thing to implement, or if it's just another supplement where there's many that are used to support the body. Do you use that at all in your practice, and what are your thoughts?
So I actually have not used that supplement. It wasn't part of my initial training and
Mm-hmm.
part of the protocol I based my practice on. I think supplements are uh, they are an important part of most protocols that I do with women. And again, it's an individual thing. Um, I was trained under basically under the protocol of Tori Hudson.
Mm-hmm.
Tori Hudson is a naturopathic doctor who works out of Portland, Oregon, and teaches at the National University. And so, and she's done a lot of research and is compiling, constantly compiling updated research. So, if again, I take that core protocol that I learned in
Mm-hmm.
school and that I've continued to learn through continuing education as well as my own clinical practice. But I do a lot of modification around that for each individual patient.
Right.
So I would really recommend that they look at Dr. Hudson's protocol because it's highly based on both her clinical years and years of. I mean, I don't know how long she's been in practice, um, at least 25 years,
Sure.
maybe more. So it's based on her clinical research and gathering data from herself and her residents and her students, as well as gathering research data. So she has a book called The Women's Encyclopedia of Natural Medicine. Are you aware of this book?
Yes, yeah, I own it, and I'm a big fan of it. I reference a lot from it in the work that I do, and I'm pretty sure that when I went through all of this myself about 4 years ago, that my naturopathic doctor had me under basically this exact protocol. So it's
Yeah.
I wanted to just touch on the AHCC thing because on a lot of like Facebook support groups and where women kind of collaborate with one another, I'm seeing a lot of like, oh, just take AHCC and you'll be fine. It's just like, oh, just take this one supplement and that's all you need to do. And I'm trying to open up women's minds that it's not just change your diet or just reduce your stress or just take this one supplement. Like I spoke to one woman who had a LEEP done and her dysplasia came back like 2 to 3 times worse when it did afterwards. And she had said that in a way getting cervical dysplasia and having high risk HPV was a blessing in disguise because it forced her to overhaul her lifestyle and to change it into these ways that she continues to practice on a daily basis all these years later. And now every system in her body continues to benefit from that, not just the suppression of this nasty virus.
And I think, you know, your point about women saying it was a blessing in disguise. I've had many patients say that about many health issues where you get this news and you think it's devastating to have and it consumes a lot of time and energy and focus, but oftentimes patients will in the end say it was a gift because it does force them to look at the choices that they're making and improve those choices. So and when you're improving your diet and you're reducing your risk factors and you're supporting your immune system, even if you don't improve your biopsy, you have improved your quality of life and you have improved your health. And you know, worst case scenario, you don't solve the primary problem, but you've headed off a lot of potential problems down the line.
Right, right. And then if women do choose to move forward with a LEEP or some kind of procedure to forcibly remove this area, the body's ability to recover and heal from that is only going to be exponential from all of this pre-work that patients put in to try and boost everything.
Yes, yeah, that's exactly right. And I think, you know, oftentimes, back to your point earlier of women feeling pressured and, you know, rushed into the procedure, like you've got to do this now. Um, I think there are times where it is more urgent to have the procedure, but there's a lot of time when there's a lot of situations where it is okay to slow down a little bit
Mm-hmm.
and try some things and make some adjustments and improve other aspects of your health and try to support the immune system. And a lot of women feel better about women who actually do end up doing a LEEP or whatever surgical procedure is advised by their medical doctor. They have a better sense of sort of acceptance of that once they know that they've done other things. They've done everything they can.
One of the things in her protocol talks about suppositories. And so
Mm-hmm.
if someone does not have access to a naturopathic doctor to help with a compounding pharmacy, there are some like green tea and tea tree oil suppositories that are sold online. Do you have any experience with women using these? Is that something that you think is worth spending the $100 on from a company?
Suppositories are a really important part of certain protocols, and I certainly have used them and continue to use them with patients. Again, there's a lot of different suppositories out there. You have to be careful about quality. And when you're getting things off the internet, I don't know. I mean, I'm not saying you can't get good quality things off the internet. You
Sure.
certainly can. But you can also get a lot of junk off the internet. So I think if someone's spending money on suppositories, it is worth spending money to talk with someone who can tell you what the most appropriate suppositories are.
Okay. Well, I think maybe just to close this out here, thank you for sharing your experience with us. I'm sure this is going to be very valuable for a lot of women to see who aren't sure if they should go to a naturopath or not. So I hope that this helps push anybody who's questioning it. But if you could share one thing in your years of practice working with women who have had high risk HPV and cervical dysplasia, what would you want them to know if you could tell them one thing?
Well, first of all, I just want to thank you for putting this together and for your interest and your effort in disseminating information to women, because I think so many people are just desperate for a more holistic approach and desperate for more information. So I think what you're doing and providing this information for women is really good.
Thank you.
You know, I initially had one answer to that question, but I think in talking with you more and through this conversation, I think I've changed the answer to that question,
All right.
my answer to that. And I think it goes back to what we were talking about earlier, that when you are um, approaching any healthcare situation from a holistic place, and you're looking at where in your life, both physically, emotionally, nutritionally, all of those areas you can make improvements and you can make changes that are going to support your immune system, support your digestion, support your mental emotional state. All of those changes are going to be beneficial. So again, like I said earlier, even if worst case scenario, the chief complaint doesn't improve, all of the side effects are beneficial and they're all going to help you in the long run. So I guess that's what I would tell people. Looking back at so many of my patients' stories and their journeys, people will tell you that some things that seem like the most awful, horrible, daunting monstrosities health-wise, women will look back 6 months later or 2 years later and see that that really actually was a gift.
Well, is there anything that you would like for the women who are listening and watching here, if they want to talk to you more, if they're anywhere in the Colorado area, or if they just want to get some information about you and your clinic, anything you want to share about the best way to learn more about you and your practice?
Well, thank you for asking. I'd say that just our website, which we recently updated, and I'm really proud of the way it looks. So hop on to our website. It's mountainriverclinic.com.
Okay, excellent. And I'll put some information in the notes for people to easily access.
That's
Okay,
great.
anything else you want to add before I wrap us up here?
No, I'll just say thanks again. I appreciate what you're doing.
Awesome. Thanks, Doc.